is my name. Co-chair is there, Thomas. The first presentation is not listed, but we're going to start with that. Dr. Abdullah will be taking us on successful treatment of extramammary Paget disease of the scalp with photodynamic therapy. The floor is yours now, please.
Today we'll talk about the successful treatment of extramammary Paget disease of the scalp with photodynamic therapy. I have no conflict of interest. Just to know, the extramammary Paget disease of the scalp is an unusual neoplasm that affect appearing apocrine gland-bearing cells such as vulva, perianal region, scrotum, and penis. The extramammary Paget disease has rarely observed in non-apocrine gland-bearing regions. Such cases referred as ectopic extramammary Paget disease. Extramammary Paget disease of the scalp is extremely rare. Only few cases reported in the literature. We have this 86-year-old male with no significant medical history presented to our center, with history of the right parietal scalp lesion for the last 10 years. This is the patient who has this lesion, which is measured around 8.5 multiplied by 6 centimeter erythematous plaque with alopecia was noted, and there was a little portion of ulceration in the lesion. Can I release this? So a biopsy of the lesion showed a pagetoid infiltration of the epidermis by atypical round single and nested cells with eosinophilic cytoplasm and nuclear hypochromasia. You have this is the cell of pagetoid cells, which is huge cells as you've seen. And then we did immunohistochemistry for the biopsy, which shows numerous tumor cells stained positively with blue alcyan reaction, which is specific for Paget disease. There was no invasion of the derms, and immunohistochemically, the tumor cells were positive for cytokeratin 7 and negative for both S100 protein and MILA-A. After careful clinical and hematological investigations, no metastasis to other organs and no additional skin metastasis was identified. The patient refused any surgical intervention because he's old. So we decided to do a photodynamic therapy. This is the machine that we used. I was working on the same disease, but in the perianal region and vulval lesion a year before to start this treatment in the scalp. So usually what we do in the treatment, we clean the area, we clean the lesion with the normal saline, and we applied 5-methyl-aminolevulinic acid, which is a topical photosensitizer on the lesion, and 1 centimeter around the clinical margins. The area is then occluded from light for 3 hours. We put like aluminum papers and cleaned again with normal saline and exposed to 37 joule per cubic centimeter of visible red light, 6,630 nanometer by galderma light. The patient has 3 sessions of photodynamic therapy, 4 weeks interval. The pain occurred during these sessions, but full length of irradiation was delivered. An almost complete remission was observed after 3 months. This is first time when he has the lesion that you have seen before, and this is complete regression of the disease after 3 sessions of photodynamic therapy. So there was a complete clinical response was maintained 12 months. We did the biopsy again, a year after the last session, and there was no pagetoid cells in the biopsy. No invasion occurred during the first year follow-up period after the first photodynamic therapy procedure. So just a few words about the review of literature of extramammary Paget disease of the scalp. It's, as we mentioned, is extremely rare disease, arises in the area other than the anogenital region and the axilla. This case, our case, was the second in the English literature, but first to be treated by photodynamic therapy. A variety of treatment options exist for extramammary Paget disease. However, surgical resection is the gold standard. Higher recurrence rate has been reported with the standard excision in comparison to most micrographic surgery. I will not go deep in the surgical treatment because this is the study which was done to compare the most surgery and standard surgery to cure the disease. The local recurrence rate was less. In a recent Chinese series, 48 patients treated by surgical resection was around 14.6%, which was lower than the reported in the literature, which is around 21 up to 61%. So the Chinese literature showing that it is less recurrence. The photodynamic therapy using 5-aminolevulinic acid is an effective treatment for several conditions which is known to Bowen disease, a subset of basal cell carcinoma, and actinic keratosis. But there is the problem that we don't have a randomized controlled trial to confirm the efficacy of photodynamic therapy in extramammary Paget disease to date. We have only 21 retrospective and 1 prospective study. Non-comparative studies were identified and included in the review. 9 cases reports with 1 to 2 patients, and 14 cases series with 1 to 16 patients. These reports total is 99, including 99 patients with 133 extramammary Paget lesions, and 3 patients has mammary Paget disease. The follow-up period was typically 1 year or less, but not less than 11 months. So with the literature showed that 77 over 133 extramammary lesions exhibiting complete response to photodynamic therapy. So 1 recurrent mammary skin lesions and 2 mammary lesions treated concomitantly with surgery also exhibited complete response. So the efficacy of photodynamic therapy was proven for the extramammary Paget disease as well as mammary Paget disease. Our patient was treated by photodynamic therapy and showed a good progressive improvement of his scalp lesion with successful outcome after 3 sessions of photodynamic therapy. So our conclusion, although the surgical resection remains the treatment of choice for extramammary Paget disease, photodynamic therapy could be the first line of treatment and excellent alternative non-invasive therapeutic option with successful outcome. Thank you for your attention. Any question?
Thank you for the presentation. We'll now entertain questions, please.
How long time to have to do a follow-up of these patients?
Usually we do a 1-year follow-up. We brought the patient every 3 months after the last session, and then we do, if we can, we do a biopsy. If there is a lesion, I have a failure of treatment for 1 patient, but it was not in the scalp, it was in the perianal region. So we did a retrospective study for those patients. I have 16 patients actually, but the regression, once we stop actually the photodynamic therapy, 9 months, around 9 to 11 months, we have a relapse. But the photodynamic therapy was excellent for symptomatic relief. You know, the Paget disease is an extremely, the patients have extreme pruritus. With this, with the treatment, after first session, you will find the difference. The patient will find the difference, especially in the perianal region. The scalp region, actually the diagnosis, the differential for the scalp lesion was not only Paget disease. We thought of Bowen disease. We thought of actinic keratosis of the scalp. All of these things. But when we did the biopsy, it was compatible with extramammary Paget disease. There was no symptoms, so we don't know much actually about the scalp involvement of the extramammary Paget disease. So we are just learning. Any other question? Thank you very much.